Hello, I'm Dr. Gabriel Esteban. As a Catholic university, Seton Hall is committed to supporting educational achievement within our community. That's why we're proud to support the important educational programming produced by the Caucus Educational Corporation.
Funding for this edition of One-on-One with Steve Adubato has been provided by the Healthcare Foundation of New Jersey, founded by the Jewish community, NJM, Choose New Jersey, Seton Hall University, Qualcare Inc., New Jersey Sharing Network, and by Gary's Wine and Marketplace, creating an individual shopping experience for every guest. Promotional support provided by Meadowlands Regional Chamber, building essential connections that drive business growth, and by Jaffe Communications, where business, media, and government converge in New Jersey.
This is One-on-One. I'm an equal American just like you are.
The jobs of tomorrow are not the jobs of yesterday.
Look at this. You got this?
Here it is, man. Look at that.
Life without dance is boring.
When you first heard that they were doing Charlie Rose and Gayle King, didn't you go, what?
Do you enjoy talking politics?
No.
People call me because they feel nobody's paying attention.
Our culture, I don't think, has ever been tested the way it's being tested right now.
Such a good question. High five.
Steve Adubato here. This is One-on-One. It is my honor, my pleasure for the first time to welcome to our program Lynne Algrant, who is the Chief Executive Officer of a great organization called the Bergen Volunteer Center. How are you doing?
I'm doing very well, thank you.
People who don't know what the center is, describe it.
Sure. So we are actually 50 years old this year, and we are both a clearinghouse for people to find volunteer opportunities, and we run direct service programs. So we're harnessing the power of volunteers to meet community needs.
How'd you get into this?
You know, I was an educator initially in my career, and then did nonprofit work with kids. And for a while, I lived in the Cleveland area, and I had the opportunity to run a civic leadership program for Cleveland, growing new leaders for a new Cleveland. And I loved that work, the intersection between nonprofits, the for-profit community, and the public sector, and how that builds community. So when we moved to Bergen County, I was searching around for something to do and found the Volunteer Center at the very point when they were thinking about starting the Bergen LEADS program.
Yeah, talk about Bergen LEADS.
So Bergen LEADS Bergen LEADS is a civic leadership program by and about Bergen County. So it's for adults. We have about 30 participants a year, and I call it a shoe leather masters. No textbooks. We really use the community as our learning space. So we meet with the heads of hospitals, we meet with superintendents of schools and classroom teachers when we're studying education. And every month, we meet monthly, we have a particular topic, an issue, but we also send the participants out to do site visits around the community and then come back and share what they've learned. So we're thinking about leadership, we're thinking about Bergen County and what its needs and opportunities are, and we're getting people excited about being civically active right here where they live and work.
What a great idea.
It's a lot of fun. We've been doing it. We just started our 9th class, and I have to tell you, every year our topics stay pretty much the same: law and public safety, local government, but the issues are changing so much and so often, so that even though we're talking with a lot of the same people, visiting a lot of the same places, over the course of 9 years, things in Bergen County have changed dramatically.
And you know, I need to say that I'll be working with your organization together with our friends at the Meadowlands Chamber. Jim Kirko's got us hooked up together. I'm coming to, because I'm a student of leadership, right?
Right.
And I
we all
actually wrote
are.
this book, Lessons in Leadership, and make the connection between what we are doing together. Actually, as we tape this program, I'm doing it tomorrow.
Right.
And what is that? Because that's not just for me. That is something you do on a regular basis, but I'm just participating.
Yeah. So we have the Fifth Friday Forum.
The Fifth Friday.
Fifth Friday. And about 3 times a year, a month we'll actually have 5 Fridays. And so we take that opportunity. If you have a standing meeting on a Friday, you've already met 4 times in the month. So we take the opportunity of the Fifth Friday to have a networking luncheon. And we're really bringing people in to talk about public policy issues, leadership issues, and it's a wonderful event. We get about 200, 250 people at each one from all walks of life, business, the nonprofit sector, the public sector, to come together and meet each other and talk about things, but then to also learn something about either the community or about pressing issues. And so you'll be coming to talk about leadership, and we're really excited about that. It's something we need to be thinking about all the time. You know, I'm sure you're going through this too, this notion that leadership is really changing, right? I'm a big Hamilton fan, right? We've had our George Washington type folks.
That's right.
But really leadership is in the actions that we do, and there are leadership moments that happen all the time. And so one of the things that we talk about in Bergen LEADS is, are we ready to step into leadership moments whenever they happen and whenever we see them happening, and to get things done. And so I'm excited to have you come and talk with us about that.
Let me ask you this. As a student of leadership, I'm fascinated by other people's view of leadership. And frankly, much of my book is talking to other people about their view of leadership. But I'm curious about this. When you talk about Hamilton and the obsession people have around the play, but also the lessons in leadership, if you will, in that play. How would you say your view of leadership has changed over the years?
That's a great question.
I don't have the answer.
Yeah, I don't think any of us do. Yeah, I think my notion of leadership, I am much more fascinated in somewhat quiet aspects of leadership.
Quiet?
Quiet, yeah.
Example?
I have a friend who describes it as leadership from the back of the room. And you know those people who sit in a meeting and who can move it right back on topic or get it going with a question when a group gets stuck? And very often they are one of the quieter people at the table, or the people who don't necessarily have position power, right? But they have moral authority power, they have questioning power, whatever it is, to bring it back on topic or to get things moving again. And so when I'm really talking to folks about leadership, especially leadership in the community space,
that's right.
Because, you know, you're not working with your boss, right? We don't have other motivating factors when we sit together as a city council or when we sit together as a board of education. We're all there because we care about the issues, and we have to move an agenda forward. But we're colleagues and we're peers, and so that teamwork interaction, that really drawing different people's skill sets out. And making sure that everybody feels included at the table, I think, are the kinds of leadership that most excite me now.
You know what's so interesting about what you just said, and not to get on a soapbox about leadership, but you just said the person in the back of the room who will often ask a question. And I've often argued that sometimes the question one asks is 10 times more important than the speech one makes. And there's incredible work, research being done by a researcher down in Philadelphia her name is Dr. Marilee Adams, who wrote a book that's simply called Change Your Questions, Change Your Life. And without going into it too much, she said, sometimes you can ask a question that no one expects, that changes the conversation and gets people to think about things in a certain way that they otherwise never would have done, which potentially changes the course of the meeting, changes the decision that is made, and changes everything. Does it make any sense?
It makes total sense.
That's leadership.
That's leadership, right. It changes the perspective.
That's a skill set.
Yeah. We talk so much about, like, think outside of the box, but how do you get out of the box?
What's the skill?
What's the skill to get you out of the box?
Yeah, everyone, these cliches,
I love
now I'm getting off the soapbox now.
No, that's okay.
All these cliches about think outside the box. Yeah, we're going to think outside the box. Well, how do I do that? Well, ask a question that no one else is thinking about. But I'm going to ask you about this, about your organization.
Sure.
These people that are a part of Bergen LEADS, they go through it, they come out of it. What do you expect from them?
It's a great question, and one that we've been asking a lot, the now what question, right? So what we're expecting, we don't have a tried and true path. We don't want everyone to run for office, although Lord knows we need good people to run for office and to be willing to, to do that, to step up. We want them to serve on nonprofit boards. We need so much leadership in the nonprofit sector from that volunteer board leadership aspect. We want them to stay involved, right? And to ask questions and to share ideas. So one of the things that I really like about Bergen LEADS is because, as you know, Bergen County with 70 municipalities, we have a difficult time sometimes as a county coming together. around anything. And business leaders and nonprofit leaders don't necessarily hang out in the same circles. And so one of the things that Bergen LEADS is really doing is becoming a central place of conversation and a central network across many sector lines. And I think that in the long run, that's what strengthens community, because we get good ideas from business people. We get good ideas from nonprofit people.
You're doing important work, Lynne. Keep it up.
Thank you.
And I thank you again for inviting me to be a part of the discussion with your leaders in Bergen County. Thank you.
Thank you. We're excited to have you, Cam.
Stay with us. We'll be right back right after this. Thank you, Lynne.
Awesome.
To watch more one-on-one with Steve Adubato, find us online and follow us on social media.
We're pleased to be joined by Mike Devlin, Executive Director, Camden Children's Garden, and also President, Camden City Garden Club. Good to see you, Mike.
Good to see you, Steve. Thanks very much for having us here.
Talk to us about gardening in Camden.
Well, gardening is alive and well in Camden. The Garden Club has been around for over 30 years. We had the good fortune of William Penn Foundation coming to Camden back in the mid-'80s and wanting somebody to start a community garden program. And at the time, I worked for Joe Roberts, who was Freeholder Director at the time, former Assemblyman, and I wrote a grant on behalf of the county and the city, and we got it. And we started community gardening at the time, and we've evolved into education programs, youth job training programs. Governor Christie Whitman invented that at a press conference one time, spontaneously. And we built the Children's Garden 17 years ago on city-owned land on the waterfront as a tourist destination.
You've been recognized nationally.
Yes, we have. We've gotten some awards from both President Bush's, father and son, and Michelle Obama included us in her book, American Grown, which was very, very nice.
You know, these young people who get involved in the garden, what do they take away from it?
They do well. We've had well over 300 teenagers and young adults come to work for us, and only one dropped out of high school in a city
right?
where they often report 60% don't finish high school.
Why is that? Well, why do you keep them?
There's a lot of challenges to living in Camden. There's not many job opportunities. We operate the garden and our programs like a family. We have 12 to 15 youth on the payroll at any one time, and they work full-time in the summer, part-time while they're going to school. If they drop out of high school, they can't stay, and they know that. So they have to stay in high school. We want them to get that far. We give them experiences that will hopefully lead them to college. We have several teachers working there. I myself, as a kid, thought about dropping out of high school, but I got into a plumber's apprenticeship, and we treat our programs as apprenticeships. We try and teach trades, connect to the county vocational school.
You're involved with the schools?
Yes, we are.
By the way, that's you
Very
as a
much
kid?
So. That's me
Gardening?
in Bergenfield.
Get out of here.
1954.
Bergenfield up in Bergen County?
That's where I grew up, Bergenfield.
Did you love gardening as a kid?
Yes, all my grandparents were from Europe. One of them was from England. And during the Korean War, when my father went back to the service, was redrafted, I was sent to live with her in Bergenfield, and she taught me gardening, and it's never left me. Now, gardening is popular. Gallup polls for years have said 50% of Americans garden for fun. That's one of their primary recreation activities. And they're also saving money on the household budget, and they're cleaning up the yard. And in Camden, we're cleaning up vacant lots and growing. A couple of years ago, the University of Pennsylvania said we grew $2.3 million worth of food, and we started with less than $200,000 in grants. So for every dollar that people invest in us and we invest in people in Camden, they'll produce with their sweat equity $10 worth of fresh produce in the state's worst food desert, in the nation's one of the 9 worst food deserts in the nation. No full-service supermarket. We have a couple of partial.
So you guys are huge in that way. By the way, talk about corporate support. The Philadelphia Eagles involved?
Yes, they helped us build the Philadelphia Eagle Butterfly House several years ago.
Where's that?
That's at the Children's Garden. It's the only year-round butterfly house. It's heated. in the state of New Jersey, and that's a picture of it right there. And they've maintained a relationship with us since, I guess the year 2000, 2001. And they send their players over once in a while. Bringing sports celebrities in is quite good. We've had Bernard Hopkins there many times.
The great Bernard Hopkins, the boxer.
I know you're a boxing fan.
From Philadelphia.
Absolutely.
Right? Good, Mike? Just like that. It's Bernard Hopkins.
Yeah, B-Hop.
So hold on. He is into this?
Yeah. Oh, yeah.
Get out of here.
No.
The executioner.
Well, I boxed as a kid.
Boxing and gardening, perfect together.
Yes, it is. And one of our youth, who's now a Camden police officer and works on Chief Thompson's team.
Yeah.
He has his fifth professional fight this Saturday. He's 4-0.
Wow. Hey, real quick, before I let you go, gardening, obesity, the connection.
Absolutely. Eating healthy. And in a place like Camden, when people grow foods, even if they're new foods, they're more invested in those foods. They will try them. It empowers them. It empowers children, and they will eat those foods, and it'll improve their health.
Did Adele actually visit?
Yes, she
Camden
did.
Children's Garden? No way. The Adele.
The Adele. She was there 2 weeks ago on a Friday, one of the days she had a concert at Wells Fargo Center, and that night, and the next night, she had a concert there.
All right.
She told her audience what a great time she had at the Children's Garden with her 4-year-old son.
Wow.
Yeah. So we got a nice little pump up for her.
Yeah, I'd say it's a nice little pump up.
And I called the English relatives, and they'll probably put that on their their newsletter at the end of the year, like they did Michelle Obama's book.
Yeah, I think that'll work.
Yeah.
So Michelle Obama, Adele, and one-on-one with Steve Adubato.
Are you a gardener, Steve?
No, I'm not, but I think I know where I rank among those three.
Well, I'm
Listen,
going to ask you to sign this hat.
I'd be glad to do it. Listen, Mike Devlin is Executive Director, Camden Children's Garden, President, Camden City Garden Club. I am not a gardener, but you have me fascinated and curious about all the positive benefits of gardening, and you're doing great work in Camden, particularly creating opportunities, job opportunities, healthier living, building up this community that is often overlooked and seen by so many as a place that doesn't have options. Thank you, Mike. We appreciate it, buddy.
And you're welcome to come down anytime.
You got it. Thanks. Right. Stay with us. We'll be right back right after this. That was great.
To see more one-on-one with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato PhD, and follow us on Twitter at Steve Adubato.
We're pleased to welcome Kristen Silberstein, Vice President of Patient Engagement and Chief Experience Officer at Holy Name Medical Center. Good to see you.
Nice to see you. Thank you for having me.
Break this down for us. Vice President of Patient Engagement, what does that mean?
Well, can I take the experience piece first?
Yeah, do
that's
that
a
one
little
first.
easier to explain to folks, because that's the piece that most people relate to. And in my mind, the experience is what happens to a patient when they enter our walls. So how does the front desk greet you? Were you able to find your way? Did the nurse communicate with you? That all builds to the patient experience. So what I've been brought on board for is to look at the non-clinical interactions that our staff are having with patients and their family members, and making sure that those non-clinical interactions rival the wonderful clinical experience that the patients are enjoying.
Why is that so important?
That's important because that's really what drives patient satisfaction. So the overall experience that a patient has is what's going to determine how satisfied they were with the care they received. That feeds into engagement. So why the experience is so important is that a satisfied patient, what we're hoping to do is turn that into a loyal patient. And that's really where the engagement piece comes in. The engagement piece, in my mind, is building on the relationship we established when the patient was in our hospital. So,
give me an example of engaging them.
For example, a patient leaves Holy Name. We're able to push out information to them to help them manage their disease. We're able to connect them with physicians in the community to help them manage their disease.
Could you also check up on them to see how they're doing?
Absolutely.
Engage, connect.
Connect with them. And in our ideal world, connect with people who don't need care right now. So prospective patients. So we're reaching out into the communities to engage those folks, to get them thinking about Holy Name before they need care.
In so many ways, this is about relationship building.
Absolutely. So healthcare is really undergoing an important paradigm shift. We are shifting from a procedure-based, payer-based relationship.
Transactional to?
Very transactional, to a more patient-consumer relationship-based model.
Is that hard for, I mean, you're articulating, you're coming into Holy Name, but for others who are so connected to, dare I call it, the fee-for-service model, do you think it's more challenging for some?
It's challenging for some. Change is hard for everybody,
it sure
right?
is.
So, and especially for those of us who have been in healthcare for many, many years, it is an industry undergoing unprecedented change, especially with the advent of the Affordable Care Act.
Right.
So that's really forced the issue. It's forced consumerism in healthcare. Consumers are making more decisions now than they've ever had to make in the healthcare space. They're choosing where to spend their premium dollars, right? They're shopping on the exchanges, a lot of them, to find a policy that suits them. But because of the advent of high deductible health plans and more cost shifting being pushed to the consumer, they're also deciding how to spend those precious healthcare dollars. And you can be sure that if they don't have a great experience, they're not going to come back and spend those dollars.
You know, Mike Marin, the CEO of Holy Name, and I have had a lot of conversations about diversity and about cultural diversity. And I know that at Holy Name, this is a big theme.
Piece.
Talk about that and what that has to do with engagement.
Sure. So when you look at the patient as a person, you need to not just look at why they're coming to you, not just look at their disease state or their diagnosis. You need to look at them as a person. You need to understand where they're coming from as a person. And there's a big cultural awareness piece of how you approach that patient. So what Holy Name is trying to do is build that awareness among its staff and do that education so they can understand that certain cultures,
such as the Korean community?
The Korean community, the Hispanic community, the Orthodox Jewish community, all of them approach healthcare in a slightly different way. And it's really trying to understand where they're coming from a cultural perspective, and meeting the patient in that space.
It's so interesting because we've had the leader of one of those initiatives, the Korean initiative.
Kyung-hee?
Yeah.
Yes.
And it struck me that, like, you could say, here we are, come to our medical center, come to our hospital. Or you could want to understand a community and understand the unique challenges they have, which is a totally different approach. But that is, in fact, important because the way I often think about this, the way you treat a patient has something to do with culture, no?
Absolutely. And maybe to put it in a simple context, we all know the golden rule, right? Treat others as you want to be treated. But in a patient engagement world, it's really trying to treat them the way they want to be treated.
Not the way you would want to be treated.
Correct. I mean, everybody, we should all be nice to one another.
Yes.
We should all look out for one another. That's not really what I'm talking about. But it's, again, trying to understand where that patient's family is coming from and treating them in a way that they're comfortable being treated.
Talk about the sandwich generation.
That's a challenge. So the sandwich generation is, they're
What does
approaching.
That mean?
To me, the sandwich generation are people probably similar to the boat that I'm in, looking at that parents who are starting to age, dealing with that aging process, dealing with planning.
Yep.
A relative of ours is recently diagnosed with early dementia. So again, trying to help navigate the system.
We're there too.
Yeah, as well as taking care of yourself and your children who are in high school and college, and you're sandwiched right in. So I think that there's a great need in our healthcare space to begin providing at least education in terms of helping folks navigate the choices that they have, looking at long-term care solutions, those types of things, but that's part of engagement as well. So we can cut patient populations in many different ways. We can look at them culturally. We can look at them based on career choices. For example, first responders may have certain needs, teachers may have other needs. We can look at them in age cohorts.
Demographics.
Exactly. And that's part of Holy Name's goal as well. So as we do these patient engagements and we do these outreach activities, what type of data are we gathering and how can we utilize that data in an intelligent way?
Kristen, I want to thank you for joining us. Kristen Silberstein is Vice President of Patient Engagement, Chief Experience Officer at Holy Name Medical Center. Thank you so much. Important stuff.
Thank you so much. I appreciate it.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the Healthcare Foundation of New Jersey, NJM, Choose New Jersey, Seton Hall University, Qualcare Inc., New Jersey Sharing Network, and by Gary's Wine and Marketplace. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.
At Gary's Wine and Marketplace, planning parties is our business. Our associates can work with you to plan the details. We offer an assortment of wine, beer, spirits, cheeses, party platters, accessories, and more. 4 locations in New Jersey and at garyswine.com.